Are you sitting there right now in pain and desperate for some relief, but you don't know what to do? Well, in this video, I'm going to show you the 5 best ways to ease your acute lower back pain and get you back to normal as fast as possible. All of these ways are backed by science and have been shown to be effective at reducing inflammation and pain. The last one in this list is my current favorite, and although it will cost you some money, I believe it is a must-have if you regularly experience low back pain. Now, before we get into these 5 ways to ease your acute low back pain, you're probably wondering if you should go to A&E or a walk-in center. Well, the first thing I want you to do is not panic. The amount of pain you're in right now doesn't necessarily mean you need to be worried. There are so many possible causes of lower back pain, and many of them will improve if you follow the right steps at the right time. But of course, there are some instances where it may be essential to go to A&E. For example, if you lose sensation in your inner thighs or your genitals, or you have changes in the ability to urinate or pass stool. Of course, if you're not sure, it's always better to err on the side of caution and phone your doctor or go to A&E or go to someone like me who is qualified to examine and diagnose. Now, I don't know what you've done to hurt your lower back, but if you're watching this and you're experiencing levels of pain higher than a 7 out of 10, then it's very likely there's going to be a lot of inflammation causing you a ton of pain. When you're in a lot of pain, your instincts take over and your body seeks to avoid this pain, which means you'll naturally try and find a position that's comfortable and doesn't make the problem worse. So naturally, you'll seek to rest, and this is a good thing. The more you can avoid making your problem worse, the better. This means you must stop all activities that have triggered the problem and seek to rest. At this stage, rest is incredibly important, and it will give your tissues and nerves a chance to calm down, and it will prevent you from making the damaged tissues worse. But the problem with resting is that if you rest for too long, you actually do more harm than good. Although it will feel good to rest, if you stay still for too long, what you'll find is that when you start moving around again, you will feel way worse. In a very loose sense, your tissues will have become stiffer or cooler by resting, kind of like when you do a cool down after exercise. Then when you start moving around again, those stiff fibers get broken up, causing more pain. A bit like a brandy snap or some brittle candy. I'll come back to this example in a minute. So my advice here is to rest for only short amounts of time, just long enough for your pain to ease and for you to get some respite. And you can do this multiple times throughout the day as you feel like the pain is getting too much. I suggest around 10 to 15 minutes maximum before going on to the next of the 5 methods. By the way, if you are in acute pain right now, then you would fit into phase 1 of my 3-phase timeline. The goal of phase 1 is to reduce your pain and inflammation. And that is exactly what all of these methods in this video will help you achieve. If you want to know more about my 3 phases and what you can do in each phase, then I would encourage you to download my free ebook, which I have linked in the description below. A minute ago, I told you to rest, but now I'm going to tell you the opposite. You have to keep moving. Movement is medicine, and in a second, I'm going to show you some simple movements that you can do to help. Do you remember I just said how resting will make your tissues become stiff? Well, rest is good because it reduces the load on the affected tissues. But the problem with resting for too long is that the muscles or tendons will become stiff, and the longer you rest, the stiffer you will become. This means when you eventually do start moving, you will find it more painful than before. Not only that, but inflammation will have built up in the area, making the nerves in the area more sensitive. It's kind of like the brandy snap example I mentioned earlier. When these are cold, they're brittle and they will snap easily. But as they get warmer, they become softer. Now, I don't have one here, so another way to think about it is to think of chewy sweets like these. As these come out of the wrappers, they're quite firm and actually difficult to manipulate, a bit like your muscles when they're cold. But as I hold these sweets in my hands for a while and gradually work them, they start to soften up more and more until they become loose, like your muscles and other soft tissues as you move around. By the way, this is the best example I can come up with, and I've been trying to think of a good example for years. So if you could think of a better analogy, please put it in the comment section below. thank you. So you have to keep moving and keep the muscles working and the blood flowing through, which will help push the inflammation away and it will prevent the muscles from seizing up. So what are these movements I'm talking about? They are the cat and cow from yoga, which have some variations, and I'm going to show you how to do these in different positions. First of all, if you can, get down on your hands and knees, either on the bed or on the floor. Make sure your knees are under your hips and your hands are under your shoulders. For this movement, start with the smallest amount of movement possible and gradually increase it as you feel like you're loosening up. So, thinking about your tailbone, tuck it under and lift your back upwards. From there, then stick your tailbone out and try and drop your belly down towards the floor. Keep switching between both positions without pausing at either end. You'll probably find that sticking your bum backwards and dropping your belly down might be quite painful. Probably the most painful of the two positions. So only go as far as you can before feeling pain and stop before you feel pain and then move back to the other position. As you keep moving, you might find you can start going further and further. This is helping your spine move in flexion and extension and working your muscles and helping them to contract and relax while keeping the load minimal through the spine. Do this 10 to 20 times. From here, you can go into what I would call thread the needle. So go back to your neutral position on your hands and knees. Next, with one hand, take it through the gap of your opposite leg and arm and try and get rotation through your spine. Again, start with the smallest amount of movement possible and gradually increase the range as you loosen up. Also, don't push yourself into pain. Come back up and repeat 5 to 10 times on one side and then do 5 to 10 times on the other side. Once you've done that, you can move into side bending the lower back. This one is a bit harder for some people to get, but stick with me here. Go back to your neutral position where you are on your hands and knees. Now, pull your hip towards your ribs like you're trying to squash your waist and then go the other way. Keep moving your hips, alternating sides, and try to do this without shifting your hips side to side. This movement is adding in a side to side movement through your lumbar region of your spine. If you can't do these on your hands and knees, you can do these sitting or even lying down. The main thing is that you're moving. Now, if you feel like things are starting to ease up, then you might be wondering if you can go out walking. A lot of people find that walking helps them, especially once they've gone past the initial severe acute pain stage. But here's something you need to be aware of. A little bit of walking might help you, but if you walk too much, it could easily make you flare up again. So I recommend starting with just 5 minutes and eventually increasing the duration as your pain decreases over the coming days or weeks. Hopefully, it'll be more days than weeks though. Now, while your back is still vulnerable, I suggest no more than 30 minutes maximum. If you walk around too much, you will increase the inflammation in the area. And then when you stop, the inflammation will continue to build in that area, eventually leading to more pain. But let's assume the inflammation in your back is high. The area will be incredibly painful and it may even feel hot to touch. So you need a way to push that inflammation away from the area. This is where you can use ice packs. A lot of my patients are unsure whether to use hot or cold. So imagine this. Imagine you are out with your friends and suddenly one of them becomes angry and irritated. What would you tell them? Go outside and cool off. So this is what you need to do with your back pain. You need to cool it off. The cold causes constriction of your blood vessels and therefore reduces the blood flow to the area. This also helps to reduce the inflammation in the area and therefore helps to reduce the pain. I recommend no more than 15 minutes per application and a maximum of 1 time per hour. But what happens if you leave the ice pack on for too long? The problem is that if you leave the ice pack on for too long, you will restrict the blood flow to the area too much and delay optimal healing time because you need blood flow to help repair and regeneration of tissues. So this is why I advise no longer than 15 minutes per time. Oh, and by the way, please make sure you are wrapping your ice pack in a towel or something so you don't give yourself ice burns. Now, while ice packs are great, they are not always ideal. You can't pull out an ice pack while you're in a car or while you're sitting in a cafe. And if you're in a lot of pain, you probably don't want to keep getting up to go back to the freezer, put it back in the freezer, or get it out again. So what can you do if you don't have access to ice packs? Well, that's where this one comes in. NSAIDs, non-steroidal anti-inflammatory drugs, such as ibuprofen or naproxen. A lot of my patients don't like taking medications unless they absolutely have to, and quite rightly so. So they will often suffer with the pain for endless days unnecessarily, or they will just try to take the bare minimum amount, just 1 or 2 per day. But think of it like this. Imagine you are trying to put out a fire and you have a bucket of water. Would you pour the water over the fire just using 1 cup? Or would you throw the whole bucket on the fire in one go? Now, sure, they might both get the same results eventually, but if you were trying to use, say, cups of water, the fire might not even get put out fully. And I'm sure you said you'd probably pour the bucket of water on the fire. And you just want to drench that fire as quickly as possible to put it out as fast as possible. So this is what I tell my patients, that it's better to take the maximum allowed dosage over 1 to 2 days than to take the minimum spread out over 2 weeks. This is, of course, not medication advice, so you must always speak to your GP or your pharmacist before taking any medications. But hopefully you get the point I'm trying to make. Now, while this will help reduce inflammation, there are, of course, risks associated with taking anti-inflammatories. What are these risks? Well, NSAIDs can pose a threat to long-term health and can be addictive. So they can cause you gastrointestinal side effects such as nausea, stomach ulcers, constipation, and of course can interact with other medications too. NSAIDs can also damage cartilage, which could accelerate degeneration of arthritic joints. So while NSAIDs have their use and can be incredibly helpful in reducing pain, they certainly don't help your body heal and should only be used in the short-term situations. But what if there was a safer and better way to decrease pain and inflammation without the risk of side effects or long-term health complications? Well, there's actually a way to reduce inflammation that's more effective than both NSAIDs and ice, which is also strongly supported in the scientific literature. This next step is my favorite step of all. It has been shown to be more effective than both ice and NSAIDs. I'm talking about red light and laser therapy, also known as photobiomodulation. Red light therapy uses low intensity visible and near infrared light to treat joint pain and injuries. Some studies indicate that photobiomodulation is more effective at reducing pain and inflammation compared to NSAIDs, with fewer risks to long-term health. It provides pain relief by increasing endorphin release, your body's natural painkillers. It reduces inflammation and stimulates the healing of damaged tissues. Additionally, photobiomodulation promotes tissue repair and wound healing by stimulating blood vessels and collagen production. This is why people use red light therapy as a beauty treatment for their faces. One device I've been using recently is the Kineon Move Plus, which is a targeted red light and laser therapy device. It's small and designed to be used specifically on painful or injured areas. I've been using this not only on my injuries, but on acute and chronic injuries of my patients, especially those who can't tolerate hands-on treatment. One meta-analysis study in the Journal of Sport Rehabilitation in 2019 found that photobiomodulation was more effective in preventing increases in tissue damage markers and inflammatory markers compared to cold therapy as a treatment for muscle recovery. Now, red light devices are not cheap, which is why I discussed the other 4 methods first. But the great thing about using red light therapy, particularly something like the Move Plus, is that it's portable and you can use it anywhere at any time. Even though red light therapy can be expensive initially, if you regularly have flare-ups and are either at risk of taking too many NSAIDs or you can't take them for various reasons, then red light therapy is a reasonable and a viable alternative as an effective intervention. So how would I use the Move Plus if I had back pain? Well, firstly, if I had just tweaked my back, I would follow the rest and move principles described earlier. I may take a painkiller such as paracetamol and then apply the Move Plus to the area of pain while I'm resting. The most effective dose appears to be about 15 minutes maximum twice per day for the Move Plus. This can be done daily and can be used as long as you want, since there have been no indications that long-term use has any negative side effects. If you want to find out more about the Move Plus, I have left a discount link in the description below. If you follow these steps, then you will soon find that your pain is decreasing. Of course, seek medical advice, examination, and treatment if you're not sure about anything at all. As I mentioned earlier, right now you are in phase 1 of my 3-phase timeline. But as your pain starts to come down from a 7, 8, 9 or 10 out of 10 to a 4 out of 5 out of 10, then what you'll find is that your muscles in your lower back and surrounding areas have become tight. It's your body's way of protecting you from damaging yourself further. So you will need to start moving into and following the steps of phase 2. And this video will guide you through the stretches and movements that you should be doing for phase 2, which is all about increasing flexibility in the lower back and the surrounding areas. Following this is incredibly important as it will prevent your lower back from stiffening up and you going back to the acute stage, which is where you are right now.